Okay, so have you ever been in the hospital or maybe needed some type of medical care?
I'm sure most people have at some point in their life,
Right.
so
I know I definitely have. And, when you think back to those times, do you remember the people who were always there making sure you were comfortable, like bringing you your meds, taking your
oh,
vitals?
absolutely. Those are the folks you really remember, the ones who made you feel, I don't know, like cared for, seen.
Yeah, exactly. And, chances are those folks were probably healthcare assistants. They're really the unsung heroes of the medical world. They're like the backbone of the entire system, providing just essential care and support.
They really are. It's amazing how much they do, and often without a lot of fanfare.
Right. And here's the thing. Their role is way more diverse and impactful than I think most people realize. I mean, we're going to really dive into that today.
Absolutely. We're going to uncover all the layers, go beyond those initial impressions and really see what it takes to be an HCA.
Yeah. And speaking of uncovering layers, what I find super interesting is the sheer variety of places where HCAs work. It's not just hospitals, right?
No, not at all. You'll find them in clinics, nursing homes, even in patients' homes, providing that personalized care.
Wow. It's pretty amazing. Imagine the adaptability you need to thrive in all those different settings.
I know. Each environment has its own unique challenges and rewards.
Absolutely. So within those settings, what exactly does an HCA do? Like, I mean, we know they help with patient care, but what does that actually look like on a day-to-day basis?
Well, it's way more than just like a list of tasks, right? It's about interacting with people when they're at their most vulnerable.
I hadn't thought of it like that.
Yeah, they're sick, they're scared, and they need comfort. HCAs are the ones who are providing that reassurance.
Yeah. They're the ones who notice the little things, maybe like a change in a patient's demeanor.
Right, those subtle changes that might signal a problem.
Yeah, that makes me think about the skills needed. It's not just about technical proficiency.
Yeah.
You need a lot of emotional intelligence, too, to excel in this role.
Oh, absolutely. You need sharp communication skills, not just with the patients, but also with the rest of the medical team.
Oh, right. So you're kind of like that vital link.
Exactly. Relaying important observations, advocating for the patient's needs.
Wow. But also, equally vital, you need empathy, patience, and the ability to just remain calm, which I imagine can be really hard in some of those stressful situations.
It's a tough job, no doubt.
No wonder they're considered the unsung heroes. And speaking of heroes, we want to take a moment to thank London Heartbeat's Z Academy.
Yes, absolutely. They're doing such great work in educating healthcare professionals.
They really are, offering over 140 courses. They really help equip HCAs with all the knowledge and skills that they need to be successful.
It's fantastic. They're a really valuable resource.
Yeah, for sure. And to all our listeners, I highly recommend checking them out. Explore their courses, see what sparks your interest, and be sure to follow them on social media.
Yes, definitely. Facebook, Instagram, Spotify, and YouTube, you name it, they're there.
And they share free content regularly, so you don't want to miss out on amazing discussions like the one we're having right now.
You know it. Knowledge is power, and London Heartbeat Z Academy is giving that power to future healthcare professionals.
So back to the skills needed to be a successful HCA. We talked about compassion, communication, organization, but are there like specific educational pathways that can help someone build those skills? Like how do you prepare for this career?
Well, it's not just about on-the-job training anymore. You can really benefit from certifications and specialized programs.
Interesting. What do those look like?
Well, these programs, they dive deeper into patient care, medical terminology, and all those ethical considerations that come with the job.
Oh, that's interesting. When we think about career paths, many people might assume that being an HCA is kind of like a dead-end job, but that's not the
Ah,
case at all, is it?
not at all. I mean, the beauty of this field is that there's so much room to grow, to advance.
I like that. So give me some examples. Like where can you go from being an HCA?
Well, imagine starting as an HCA and then you become a nurse aide, then a licensed practical nurse, or even a registered nurse. The sky's the limit.
That's amazing. It's so inspiring.
Yeah.
It's not just a job. It's like a launching pad for a whole career in healthcare.
Absolutely, it is.
And speaking of career prospects, what does the job outlook look like for aspiring HCAs?
It's really promising, actually. I mean, with the population aging, there are more and more healthcare needs.
I hadn't thought about that. Makes sense, though.
Yeah, so the demand for HCAs is like projected to skyrocket. So that means high job security, lots of opportunities out there.
That's really good news for people entering the field. But okay, let's address the kind of the elephant in the room here. I mean, being an HCA isn't easy, right? It's a physically and emotionally demanding job.
It is.
And I imagine there are days where it really takes a toll on you.
Absolutely. Long hours,
Yeah.
physically demanding tasks, dealing with illness and suffering.
Yeah.
It's definitely not for everyone.
Right. But I bet the rewards are pretty immense too. What are some of the most rewarding parts?
Well, for me, it's about those human connections. Just like imagine building those relationships with your patients and their
Oh,
families.
yeah. And being there for them during those tough times.
Exactly. And then, witnessing the impact you have on their lives, even in a small way.
Yeah, it's about making a difference.
Exactly. And it's also about being part of a team,
Yeah.
working together with nurses, doctors, other healthcare professionals to provide the best possible care.
Teamwork makes the dream work, right?
Exactly. You really feel a sense of purpose.
Yeah, definitely. So HCAs aren't just working in isolation, they're integral members of that whole healthcare team.
Oh, for sure. They're the eyes and ears on the ground, They're the ones who spend the most time with those patients.
And they notice the changes that maybe others wouldn't.
Right. And those observations, they can be really crucial to make sure patients get the right care.
Yeah, it's a good reminder that everyone on the team, from the doctors to the nurses to the HCAs, they all play a role. And speaking of different roles, one thing that strikes me is how diverse the HCA profession is. You have people from all different backgrounds and experiences coming together to care for others.
It's really cool to see, and that diversity is so valuable, especially when you're working with, all sorts of different patients from different backgrounds.
Absolutely. So, like, imagine having HCAs who speak multiple languages or understand different cultural nuances.
Oh, that's huge for building trust and rapport.
It's about creating a more inclusive and sensitive healthcare environment. And speaking of inclusivity, we can't talk about the future of healthcare without talking about technology. We've got electronic health records, telemedicine, even artificial intelligence is changing things. How are HCAs adapting to all of this?
Well, it's an exciting time, but it definitely requires adaptability.
I can imagine. So how are they learning to use these new tools?
Well, they're learning to navigate those electronic health records, facilitating virtual visits, and they're even using some of those AI-powered tools to enhance patient care.
Wow, it sounds like the job itself is really changing.
It is. It is.
Do you worry that technology might, like, overshadow the human element of care?
It's a valid concern, but I think technology should be seen as a way to enhance the human touch, not replace it.
Oh, okay, that makes sense.
Yeah, so, those AI tools can help with things like data analysis and medication reminders, but it's the HCA who provides that compassion, builds those relationships.
Yeah, the things technology can't do. So it's about striking that balance.
Exactly.
And speaking of balance, we talked about continuing education for HCAs. How can they stay ahead of the curve? Because things are constantly changing.
Lifelong learning is so important. There are so many opportunities.
Yeah, give us some examples, like what can they do?
Well, there are workshops, seminars, online courses. You can even do formal degree programs.
Oh, wow.
And, lots of healthcare facilities offer in-house training to keep their staff up to date.
Okay, so there's a lot of support for those who want to keep learning.
Yeah, absolutely.
That's great. Now, before we move on, I want to revisit the ethical side of things. You mentioned confidentiality and patient advocacy before.
Mm.
Can you give us some more specific examples of, like, what ethical challenges HCAs might face? I think our listeners would be really interested to hear about that.
Sure. I mean, HCAs are often in a position where they have access to sensitive information, and they're involved in these very personal aspects of care.
Yeah, so give me an example, like a real-life situation that an HCA might face.
Okay, well, imagine an HCA is caring for a patient who is having a really hard time making a medical decision. Maybe there are family members who have different opinions or their personal beliefs clash with what the doctor is recommending.
Wow, that's a tough spot to be in.
Right. And the HCA, they have to walk this line, they have to respect everyone's privacy, but also make sure the patient has the information they need. It's really tricky.
That's a great example. It really shows how demanding this job can be.
Exactly. And as healthcare keeps evolving, these ethical considerations are only going to become even more important.
I imagine so. So HCAs really need that training and that support system to help them make those tough decisions.
Yes, and it's all about keeping that patient's well-being at the forefront.
This has been so insightful. We've explored so much, from the everyday stuff to those bigger trends in healthcare.
It's been great.
And again, before we move on, I want to thank London Heartbeat Z Academy. They're doing such fantastic work.
They really are.
To everyone listening, Please go check out their website and social media channels to learn more.
You won't regret it.
Okay, so as we move into the next part of our deep dive, I want to leave our listeners with a question to think about.
Okay, so knowing everything we've talked about, all that depth and breadth of this role, how can we as a society, how can we better recognize and support the contributions of HCAs?
That's a great question.
Mm-hmm.
And we'll explore that more in part two.
Yeah, it's a question worth thinking about. How can we do better? And I think one way to answer that is to look back at how vital they were during those really tough times. Think about the pandemic.
Oh, yeah, for sure. HCAs were, they were on the front lines. It must have been so incredibly demanding physically and emotionally.
It was. Yeah, they were true heroes.
Yeah.
Putting themselves at risk to help others.
Absolutely. I'd imagine those experiences, though, they probably led to some valuable insights. Maybe even changed how we approach healthcare.
Oh, absolutely. The pandemic, it really forced us to think differently, to adapt and innovate, and to find new ways to deliver care safely.
That makes sense. So, like, what kind of changes did we see?
Well, for one, the importance of infection control. That became so clear.
Right.
And the need for really clear communication, across the whole healthcare team, that was huge. But, I think one of the biggest things we learned was just the importance of human connection, that compassion, especially in a crisis.
Oh, yeah. I think we all learned a lot about ourselves and our healthcare system during that time.
We did.
And speaking of the healthcare system, HCAs aren't just working in hospitals and clinics. They're also a vital part of community health, right? All those outreach programs and initiatives.
Oh, totally. They're out there educating people about health and wellness, advocating for those who maybe don't have easy access to healthcare.
It's really great to see how their role extends beyond those traditional settings.
Mm-hmm.
So, for someone listening who's thinking, this sounds amazing, I want to be an HCA, where do they even start?
Well, there's tons of information and support available. There are a lot of online resources. You can find courses, certification programs, all geared towards people interested in this career.
Okay, so start online, but is there anything else they can do?
Well, connect with people. A lot of professional associations have networking events and mentorship programs, and that's a great way to get advice and insights from people who are already in the field.
So do your research, explore the options, and then reach out to people. Okay, that's good advice. And, speaking of research, let's talk a little bit more about the technology side of things. We mentioned EHRs, telemedicine, AI, but how is that actually impacting the daily work of an HCA?
Yeah, it's a fascinating evolution. EHRs, for example, they've really changed the way documentation and communication happens.
So HCAs are using those systems all the time.
Yeah, they're accessing patient information in real time. It makes everything so much more efficient. And it frees up more time for them to spend on direct patient care.
Oh, that makes sense.
And then, telemedicine has been huge, especially for people in remote areas.
Yeah, or those who have trouble getting around.
Exactly. And HCAs play a key role in facilitating those virtual visits.
So they need to be comfortable with the technology themselves.
Yeah, definitely.
I guess I'm wondering if there's a risk that, all this technology takes away from that human element of care. You know what I mean?
I think that's a valid concern. But to me, technology is a tool, right? It's there to enhance the human touch, not to replace it.
Okay, so it's about using it wisely.
Right. So, AI can help with certain tasks like analyzing data or sending medication reminders, but it's still the HCA who is building that relationship, providing that compassionate care.
I see what you're saying. It's about finding that balance.
Exactly.
And we were talking earlier about continuing education for HCAs. With everything changing so fast, how can they make sure their skills stay relevant?
Yeah, lifelong learning is absolutely essential. And luckily, there are tons of opportunities.
Yeah, like what kind of opportunities?
Well, there are workshops, seminars, online courses, even formal degree programs. And, a lot of healthcare organizations, they offer their own in-house training too.
Okay, so there are a lot of ways to stay up to date.
There really are.
Now, I want to circle back to the ethical part of the job.
Yeah.
Earlier we talked about confidentiality, patient advocacy. Can you give some concrete examples, maybe some dilemmas that HCAs might face?
Sure. Picture an HCA caring for someone who's struggling to communicate their needs. Maybe they have a cognitive impairment or a language barrier.
That sounds really challenging.
It is. And the HCA needs to find a way to advocate for that patient, make sure their voice is heard, even if it's difficult.
That takes a lot of empathy and skill.
It really does. And it shows why ethical training is so important. HCAs need to feel confident in handling those sensitive situations.
It's not just about knowing how to do the job. It's about knowing how to do it the right way.
Exactly. And as healthcare gets more complex, those ethical considerations are only going to become more important.
Wow, we've covered so much ground today. It's been really fascinating to learn about all these different aspects of the job.
It really has. The world of healthcare assisting is constantly evolving, and I hope we've given our listeners a better understanding of just how vital this role is.
Me too.
Hmm.
And before we wrap up this part, I want to, again, thank London Heartbeats Z Academy. They're really doing great work in educating healthcare professionals.
They really are a fantastic resource. I mean, they have over 140 courses plus a ton of free content. It's amazing.
So listeners, definitely check them out on their website, Facebook, Instagram, Spotify, YouTube.
Yeah, all the places.
Okay, so as we head into the final part of our discussion, I want to leave you with another question to ponder.
All right, so knowing everything we know now about the impact HCAs have on people's lives, how can we as a society elevate the perception of this profession? How can we make sure these unsung heroes get the recognition and support they deserve?
It's a big question. I mean,
Yeah.
how do we actually shift those perceptions and make sure HEAs get the recognition they deserve? It's obvious they're like so much more than just assistants.
Yeah, I agree. And I think it starts with awareness. We
Right.
need to shine a light on the skills it takes to be a great HCA, the knowledge, the emotional intelligence, all of it.
Right. Because we've been talking about their role in patient care and how they're dealing with all this new technology, and then the ethical dilemmas too.
Exactly. It's a complex job and it requires a lot of different skills.
So we need to move beyond just that assistant label and show people what they really do.
Yeah, exactly. And it's not just about awareness. We need to think about the practical stuff too.
Like what?
Like making sure HCAs have good working conditions, fair pay, and opportunities to learn and grow. Those are all crucial.
Yeah, absolutely. It just makes sense. If we want the best people caring for our loved ones, we got to create a supportive environment for them.
Right. It's an investment in better healthcare for everyone.
And at the end of the day, when we need care, it's often an HCA who is there for us, providing comfort, support, just listening.
They are the unsung heroes, that's for sure. They make such a difference for patients and their families, every single day.
That's a perfect note to end on. We've come to the end of our deep dive into the world of healthcare assistance. Hopefully you've learned a lot and come away with a deeper appreciation for these amazing individuals.
I think so. We've seen that HCAs are so much more than just assistants. They're at the heart of what makes good healthcare possible.
They really are. And to all the HCAs out there, thank you. Thank you for all that you do. You are making a world of difference.